Hello there and welcome to the clinic. So today I would like to show you this very special poster. This is Disorders of the Eye. One of my personal favourite posters that I've come across in the years of testing. You may have seen it yourself in your optometric consulting room. Now the reason why I like this poster so much is because not only does it show you the normal features of the eye very well, which are nicely labelled, but it also shows you some of the things that can go wrong around or within the eye. And today I'm just going to go through the poster in a little bit more detail to help you relax and understand a little bit more about the eye. So I'm going to start with the normal eye anatomy. What we've done is we've taken almost a quarter slice from the eye here to give you a good view of the retina, almost a cross-sectional view here of the eye. So starting at the front, the white part is the sclera. The coloured part of your eye, which is the iris, and the hole in the centre is your pupil for allowing light to pass through and for the retina to capture the light and convert it into chemical energy. Now here you have your focusing apparatus. This is the crystalline lens here, attached to the ciliary body with the lens zonules here. Now just back to the front, the anterior portion, you have the cornea there, which should be the clear, transparent window to the eye. Externally, we have the eye muscles here. We just have two on this diagram. We have the superior rectus and the inferior rectus, extraocular muscles. And then we have the retina. We have the cross-sectional three layers here, the sclera, the vascular choroidal layer, and the retina itself. Here you can see what looks like a little planet. That is your optic nerve head, where the nerve fibres collect and travel all the way to the visual cortex for perception. A little slightly darker area here, which is slightly more pigmented than other areas of the retina. This is the macula, which is associated with your central vision. And then you have the veins and the retinal arteries nourishing the ocular tissue, and the veins draining the blood in this direction. Okay, so that is the cross-sectional quarter slice of the eye. We have another cross-section here, a little close-up of the retina, and a zoomed in appearance of a normal optic disc. You can see there is your optic disc or your optic nerve head. You have your veins and you have your optic cup within the optic disc there. And just those little fine pale dashes that you see coming away, they are the retinal nerve fibres there. Okay, so looking at this diagram here, this is showing an exotropia, an outward deviation of the left eye. You can see that little white spot in each eye. That is the corneal reflex. So this eye is looking straight, you can see that the corneal reflex is in the centre of the pupil. The corneal reflex remains central, but because the eye is turning out, the reflection on the cornea is here. And as you can see, we would call this a left exotropia or a left divergent squint. Okay. We have the opposite here. We have an esotropia. You can see the left eye is turning in. The corneal reflex is not in the centre of the pupil like this eye. So that's one of the things we look for, your corneal reflexes, to see whether you have a deviation of the eye. So we have an inward turn here, a left esotropia, or a left convergent squint. Okay, so we're going to look at my favourite part here. We're going to have a look at some more things that can go wrong with the eyes, beautifully illustrated here. So one of the things we'll look at is whether you have some blepharitis, the bacteria that lives on the lids. Is it causing inflammation? So I'll be looking at the lid redness, lid hyperemia. By looking for any scales, flakes, deposits on the lid margins, upper and lower. We'll also pay close attention to the conjunctival surface, looking for any involvement there, and on the cornea of the eye. So that is one condition we could look for. Another common condition is conjunctivitis, inflammation of the conjunctival layer that covers the sclera there, the transparent membrane. Has this become inflamed? So we'll be looking at the conjunctival redness. We're looking at the cornea for any involvement. We'll be looking for any discharge in the eye, whether that's sticky, like here, or any watering. And we will also flip the upper lid, have a look underneath there for any palpebral conjunctivitis as well as bulbar. So that is conjunctivitis. Now if our patient is diabetic, we'll obviously be dilating the pupils and we'll be having a look for anything related to the diabetes, which if there is, we refer to as diabetic retinopathy. So we're going to be looking for any exudates, any areas of ischemia, shown by this cotton wool spot here. We'll be looking for any dot and blot hemorrhages on the retina. In the more advanced cases, we'll be looking for any new vessel growth, any neovascularization, any pre-retinal hemorrhages, venous bleeding, and anything else that comes along with diabetic retinopathy there. We'll also be looking at something that affects your macular region. We'll be looking for any macular degeneration here. So we'll be looking for any waste products, such as these here, which are drusen. We'll be looking for any leakages here, like this macular edema, and for any hemorrhages in the macular area. So that will certainly affect vision if someone has wet macular degeneration, and even dry macula can affect the vision, so that's a very important one there. Something very serious is ocular cancer. So this is known as a melanoma, likely a choroidal melanoma, growing within the, or originating within the choroidal vascular layer here. As you can see, it's almost mottled, dark grey in appearance. So if we see one of these, we'll be dilating your pupils, getting a closer look, looking at the elevation using the Volk lens and making a prompt referral. Another condition you've heard of is glaucoma, raised intraocular pressure is the pressure of the eye causing damage to the optic nerve head. Is there extra cupping compared to what we see in the normal here? Do we see any vascular involvement, such as bayoneting here? We will use the Volk lens to check the depth of cupping. We're looking at how pale the optic nerve head and the neural retinal rim appears. I'll be looking at the lamina cribrosa within the cup, and for any splinter hemorrhages, peripapillary atrophy, to determine if your eye or eyes are suffering from glaucoma. So we'll also be checking the eye pressure and the peripheral vision in the eyes to come to some kind of conclusion, and if available, optometrists can also perform an OCT scan to check cross-sectional appearance of the optic nerve and check the thickness of the neural retinal rims. Okay, moving on. Something that is very common in the population, vitreous floaters. So little transparent or yellow opacities within the jelly of the eye, moving around. So what we must determine is if somebody has vitreous floaters, how long have they had them? Has there been a sudden increase in the amount of floaters? Because if there's been a sudden increase, or they've become larger quite quickly, this leads to something related here, retinal detachment or retinal tear. Has the retina detached, or is there a rip in the retina that is accounting for an increase in quantity and size of your vitreous floaters? If we see no retinal pathology following dilation and the patient's floaters are about the same, if they haven't changed over the years, we'll note this on the record and just assume that they are normal vitreous floaters there. Okay, so they're very common. I have them myself, but as far as I'm aware, I don't have any retinal tear or detachment in my eyes. And also with retinal detachment, as well as an increase in floater size and quantity, the patient may be experiencing flashing lights somewhere in their peripheral vision. The floaters may appear as cobwebs, or the patient may be seeing a dark curtain or veil from any angle within the vision. So that's a very important condition to be looking out for. It requires a good case history in terms of asking about the floaters and any other symptoms associated with retinal tear or detachment. Another very common condition we see in practice is cataract. Okay, so cataract develops within the crystalline lens. So if we're focusing on age-related cataract, over the years, the crystalline lens can become more opacified, more blurry. As you can see here, the crystalline lens has become quite foggy compared to the normal lens here. And as light comes through the eye, it might be causing a little bit more blurred vision, a little bit of light scatter and glare for the patient. And also, as it slowly develops, their colour perception will potentially reduce and change. So we will obviously check the vision, we'll dilate the pupils, have a look at the cataract, have a look beyond the cataract at the retina. Obviously a cataract can obscure the view, so we must dilate the pupils, make it bigger, and see what's going on behind the cataract. Could there be some diabetes at the back of the eye? Could there be some macular degeneration, for example? And if the cataract is causing problems to the patient, if their quality of life is reduced, then we might want to consider referring them for cataract surgery. So we can remove the cataract within the eye and place a little implant within the lens sac. And finally, moving on to the more anterior part of the eye, the cornea. We must also be looking for any corneal ulcers or any pathology that can affect the cornea. So this is where we can use our slit lamp. We're looking for any ulcers or hypopyon in the anterior chamber, which is the pus accumulating there. There is the peripheral ulcer, which would no doubt be causing the patient a significant amount of pain, discharge and eye redness potentially. We're looking for any inflammation of the cornea, such as keratitis, some infiltrates here, a little bit of corneal inflammation. This is known as marginal keratitis. And another type of ulcer we'll be looking for is a herpes dendritic ulcer, which you can see stains with fluorescein, and you get this almost branched corneal ulcer appearance. That must be dealt with promptly if that is spotted in the clinic. So I hope, like me, you've enjoyed learning a little bit more about the eye and the things we're looking for, as well as being able to understand the normal anatomical appearance of the eye. So that is disorders of the eye completed. I'll see you again next time in the clinic.